Welcome to Chapter 2, Modern Day Human Services, Policies and Programs, Interventions, and Demographics. Mental health agencies and programs. Community mental health centers were first established following the Community Mental Health Centers Act of 1963. They were created to provide services for people with severe mental disorders, such as schizophrenia, and for people who were at risk of committing suicide. These mental health agencies include nonprofits as well as government-funded programs such as Child Protective Services and Adult Protective Services. Currently, the name of these centers has changed in many areas to County Behavioral Health Services. In 1979, the National Alliance for the Mentally Ill was founded to provide service and support, education, and advocacy for people with mental illnesses. This is a growing population. Today, NAMI is the largest grassroots mental health organization in the United States. In 1997, President Clinton signed into law the Mental Health Parity Act of 1996. This landmark law began the process of requiring employers who offer mental health benefits to include some similar insurance coverage for their employees who have mental illnesses or brain disorders, as compared to equally serious physical disorders. This was a promising step in decreasing negative stigmatization that often exists around mental illnesses in the workplace. Other federal level of support for mental illness. In 2001, President Bush launched the New Freedom Commission on Mental Health, which is a key piece of the New Freedom Initiative, which advocated for transformation of mental health care delivery system that gave more power to consumers. And in 2008, Congress passed the Paul Wellstone and Pete Domenici Mental Health Parity and Addiction Equity Act, which required health insurance to cover both mental health, including substance abuse, and physical health issues. Other examples of how government supports persons with mental health disturbances is through the United States Department of Health and Human Services, which oversees several administrations such as the Center for Disease Control and Prevention, National Institute of Health, and the Indian Health Services. This department is designed to provide education, support, service coordination, and funding for individuals and groups who need mental health-related assistance. One agency within the Department of Health and Human Services is the Substance Abuse and Mental Health Services Administration, whose mission is to reduce the impact of substance abuse and mental illnesses on Americans' communities, as it was estimated that 20 million people in 2012 did not receive the services that they needed. The government also housed programs that protect one's mental health due to abuse or neglect, including the Administration for Children and Families. And in 2003, the Child Abuse and Prevention Treatment Act was reauthorized to provide continuous support to the prevention, assessment, investigation, prosecution, and treatment of children who have been abused or neglected. In the private arena, health maintenance organizations, known as HMOs, provide a wide range of mental health services, but this is not a long-term situation. In most HMO plans, you must see health providers who are in the network for your plan or hospital. Often, HMOs provide a wide range of mental health care and services that are low cost to the clients, but they do not permit clinicians to provide long-term treatment for the most part. In 2010, President Obama signed a comprehensive health reform, the Patient Protection and Affordable Care Act, into law. The overall goal of the ACA is to ensure that all Americans have access to quality, affordable health care. Modern social welfare program. Today, there are international relief bodies, including the Red Cross, World Health Organization, and the United Nations Children's Fund, UNICEF, which provides social welfare services throughout the world, especially during times of a disaster. In the United States, there are several forms of social welfare, including social insurance such as Social Security, unemployment insurance, and general assistance, and health services such as Medicare and Medicaid. There are also food and shelter programs such as food stamps and Section 8 housing. Other public assistance governed by the state and federal include Child Protective Services, the Elderly and Disabled Protective Services, school lunch, housing for low income, also known as Section 8 housing, and thousands of workers are employed in these social welfare agencies. Workforce development. the end of welfare as we have come to know it. In 1996, President Clinton signed the Personal Responsibility and Work Opportunity Reconciliation Act, which is considered a major shift in the method and goal of providing assistance to the poor. The bill added a workforce development criteria encouraging employment among people who are poor. President Clinton's goal was to end welfare as we have come to know it and discourage dependency on the system. As a consequence of this act, if a person is not an abused or needy child, a vulnerable or needy elderly, or diagnosed with a disability, most government-run agencies will not provide social welfare. Modern correctional system. Crime is a major problem in the United States, and unfortunately, the correctional system is overwhelmed by inmates. Correctional facilities exist in the city, county, state, and federal levels. These programs are usually part of a jail or prison system. Because these correctional facilities are often overcrowded, most communities have organized a Department of Probation, which allows people who are convicted of crimes to live within the community while they're being monitored by probation officers. This system employs thousands of probation and deputy probation officers, juvenile hall counselors, and other human services workers. And a parole officer explains that those who work in probation or parole oftentimes feel like they're street social workers, where they're working to eradicate poverty, provide counseling, and assist with job placement as well. The Department of Justice oversees the Office of Juvenile Justice and Delinquency Prevention, which supports states and communities' efforts to develop programs for the needs of juvenile offenders. And in 2000, Congress passed America's Law Enforcement and Mental Health Project, assisting states and communities to put into action approaches to divert offenders into treatment programs, particularly those with mental illnesses charged with nonviolent crimes. Within the correctional system, there are restorative justice programs which bring ex-offenders, crime victims, and families together for conflict resolution. Their goal is to rehabilitate and reintegrate offenders into society. Human services professionals working in the correctional facilities receive very little training. Therefore, we need more trained individuals to help with this special population. Even though these programs are often in place to rehabilitate these offenders by providing them with life skill training, vocational training, healthcare, and relapse prevention, it was reported in 2011 that 4 out of 10 offenders will return to the state prison within 3 years of being released. Now we're going to turn to our modern educational system, which includes public funding for K-12 education and funding for community colleges and state-funded universities. Within the education system, there are many barriers for children with disabilities. And to meet the needs of these children, the Education for All Handicapped Children Act was passed in 1975 to protect the rights and meet the needs of infants, toddlers, and children with disabilities. And during the Bush administration, between 2000 and 2008, the No Child Left Behind program was proposed. This program was intended to expose all children on the same level of education, and therefore, hopefully, this is to increase literacy in our country. Our public school system has many challenges, and some parents have become dissatisfied with their public schools. And this dissatisfaction within public schools has spurred interest in private education, such as charter schools and private schools. Some believe that the more rigorous, these private schools are safer. They offer, better educational experiences. So some parents do send their children to private schools and charter schools. In the United States, the school to prison pipeline is referred to the disproportionate tendency for children from disadvantaged backgrounds to become incarcerated due to the exclusionary school discipline policy. This impacts children of color in particular and children with disabilities. Now we're going to look at some really important data. In this illustration, students of color face harsher discipline and are more likely to be pushed out of school than their white counterparts. It's estimated that 40% of children expelled from U.S. schools each year are Black, and 70% of students involved in school arrests are Black or Latinos. Black students are 3.5 times more likely to be suspended than white students. Black or Latino students are twice as likely not to graduate from high school as white students. And 68% of students in the states and federal prisons do not have a high school diploma. And if we're looking at the foster care system and the foster kids, the situation for them is even dire. So we're looking at here 50% of children in foster care system are Black or Latino. 30% of foster care youth entering the juvenile justice system are placed there for behavioral cases. 25% of young people leave the foster care system, will be incarcerated within a few years after turning 18. And 70% of inmates in California, in the California state prison system, are former foster care youth. Modern day nonprofits. According to the National Center for Charitable Statistics, in 2013, there are nearly 1.5 million nonprofits registered currently in the United States. Today, many are more dependent on various government grants or funding to operate. They rely on volunteers and interns, and they pay for employees often that's not really comparable to those working in private agencies or public agencies. Many examples in human services include battered women's shelters, homeless shelters, group homes for abused children, low-fee mental health agencies, residential halfway houses for convicts released from prison, anger management group, drug education groups, and tutorial programs at the library. Various levels of interventions. While many of the policies, programs, and approaches to human service delivery have assisted populations in making changes at a structural level, most of the problems that bring people to see human services workers today must be addressed at the individual or community level. So often there are specific levels of intervention that are utilized. These levels are micro, meso, and macro. The micro level intervention focus on working with the individual. The meso level focus and involves working with families and small groups, and the macro level intervention involves working with organization and communities. So when you're working with clients, you also want to understand the needs of people who seek services in order to apply the appropriate solutions. And that can range from preventative measures to just maintaining their life. These different levels of solutions include primary, secondary, and tertiary interventions. So primary interventions, we can look at it as to prevent the occurrence of a problem by counteracting circumstances of risk factors. And some of the programs examples that are preventative interventions or primary interventions are Scared Straight, Head Start, or the DARE program. And secondary interventions includes efforts to assist people who have already demonstrated early signs of dysfunction or problematic behaviors. And this is aimed to reduce the duration of the problem. And the interventions are immediate and provide early enough so that the problem prognosis is good. So an example of this is crisis intervention. Crisis intervention is the best example of secondary intervention. And tertiary interventions are used when those with chronic problems really pretty much to help them be as productive as possible. Demographic shifts. Modern-day human services policies, approaches, and programs are highly influenced by the needs of the population. These population shifts and demographic changes have made approaches to human services more complex and require that human services workers consider the unique cultural needs of people more critically than ever before, especially when designing and implementing policies and programs and services. A culture can be thought of as operating both within and outside of us. So as an individual, on an individual level, we can look at a person's value, beliefs, explanatory system, and behaviors that are learned in the family and within social groups. So you need to consider culture when working with people and understanding their background as well. And also a consideration of culture often includes their age, their gender, race, and ethnicity, socioeconomic status or social class, sexual orientation, religion, and disability or functional level. And right now, one of the greatest challenges in our society is attributed to the increasingly aging population. And oftentimes, this is referred to as the graying of America. And according to the National Institute of Aging, today, people age 50 and over comprise 24% of the U.S. population, with 17 million Americans between age 75 and 85. And by 2060, the population age 65 and older is projected to reach 90 million, with 23% of the population being 85 and older by 2050. Other major source of demographic change is due to the increase of immigration. And over the last, 20 years or so, immigration has expanded immensely. And based on the 2010 census data, it indicates that the U.S. immigration population was about 40 million, or we can look at it as 13% of the total population. Demographic shifts and ethical racial issues. As we consider the demographic shifts in more people within the aging population, when helping these individuals, we must consider their racial backgrounds as it impacts their health-seeking behaviors, adherence to medical regimens and self-care practices, and the utilization of healthcare in general. And for example, Asians and their communication style may be different. They may value emotional restraint over direct expression. So when you're working with someone of that nationality, just make sure that you're respectful. I mean, you should be respectful in general, but just, in particular different groups or race, you might want to consider their communication style when you are helping them. And it's also imperative that each person's or group's needs, strengths, and experiences are taken into account when you're caring for or working with these individuals. Multicultural programs and policies. In working with a diverse group of clients, we must strive towards awareness of discrimination and biases and move towards a more culturally sensitive services and policies. And also we must be aware of the social and political conditions that have caused various social problems and how current institutions may perpetuate these issues.